Hi, I'm the level one nursing student. I was wondering if I could follow you around today, maybe get an SBAR on your patient.
Sure. Um, we have patient in room 231. Her name is Shanae O'Connor. She's an African American female, 34 years old. She has an allergy to trimethoprim, sulfomethazole. She's full cold, and her doctor is Dr. Ellen Engelbert. She's on universal precautions. She presented today with a fever of unknown origin. She does have end-stage renal disease. She's undergoing hemodialysis. She's a type 1 diabetic since the age of 8. She has a left forearm AV graft put in about 11 months ago. Her pain level is at a 4. She does have proliferative retinopathy and diabetic neuropathy, numbness and tingling in bilateral lower extremities. She denies any muscle, joint pain, or strength, decreased strength or range of motion. She denies any shortness of breath, pain, with breathing or recent colds. She quit smoking 2 years ago, and she denies any swollen, tender lymph nodes. She denies any chest pain or palpitations, but she is taking a daily aspirin of 81 milligrams. She's taking that PO. She denies any abdominal pain or recent weight gain. I'm sorry, she has had a recent weight gain of about 10 pounds over the last few weeks. She is on a renal disease diet. She has noticed a recent decrease in her urine frequency and volume. She denies any pain, burning, or difficulty urinating. There is an increase in the concentration of her urine, and she's noticed it's dark in color. Her current input is 375 milliliters, and her output is 200 milliliters. Her skin is intact with no issues. Aside of the AV graft, there's no tenderness or drainage or recent color change. She did have an infection in the AV graft about 3 months ago that resolved after IV antibiotics. Her vitals are blood pressure 138/78. Stats is 96% at room air. Her heart rate is 95. Her temp was 101.1. And her last AccuCheck was 155. She does have a right median vein IV peripheral, and she's to be administered the normal saline at a continuous rate. She has her labs pending, but we did get a urinalysis that was positive for white blood cell CAS.
So I just have a couple questions. Why especially is the client receiving this medication, and what is the action of the medication on the body?
The client presented with a fever, and she does have a positive urinalysis that is showing the white blood cell CAS. So we want to begin her on a broad spectrum antibiotic. And the action of this medication, the antibiotic, is to kill or inhibit cell wall synthesis, which prevents bacterial growth.
Okay, and when would you question administering this medication?
Well, you want to check the patient's allergies. You want to make sure the patient is scheduled for renal dialysis within 48 hours because she does have end-stage renal disease and she is on hemodialysis. So when you administer this antibiotic, you want to make sure that she's scheduled to have that done within 48 hours. And the recommended, did you ask me the recommendation?
Oh, does the medication have a serum therapeutic level?
I'm sorry. Yes, it does. There's a therapeutic effect at around 250 milligrams to 500 for a moderate infection, and you want to administer that every 6 hours. Or it can be 500 milligrams to 1 gram for a severe infection.
Oh, okay.
Administered every 6 hours.
And what vital signs would you be monitoring?
You want to monitor level of consciousness, temperature, all vitals.
Okay. And what physiological parameters should be monitored when the
You
medication is
want to
being
check
administered?
for any type of itching, redness, pain. You want to monitor the IV site. You want to check it for any type of infiltration and any type of swelling.
Okay. All right. Well, what interventions would you teach to the client to ensure medication is administered safely in the hospital?
Well, in the hospital, you always want to follow your 5 rights of administration. You want to check the IV site for patency, and you want to explain to the patient the action of the medication and any adverse reactions.
And what about at home?
At home, you want to make sure to tell the patient to report to her provider any type of adverse reactions that she may notice, such as diarrhea or blood and stool, because these symptoms can occur several weeks after she's taken this antibiotic.
Oh, and what are the potential side effects or adverse reactions?
You want to watch for dizziness, hypertension, diarrhea, nausea, vomiting, rash, sweating, any type of C. diff associated diarrhea.
Okay, and how would you know if the medication has been effective?
Well, we are going to monitor her vitals for any resolution of the signs and the symptoms. We want to notice a decrease in her white blood cell count. Her fever should decrease, and there should be an increase in her output.
Okay, well, I think that's all the questions I have today for now.
Okay, well, we're going to go ahead and go into the room and administer her normal saline and go ahead and administer her antibiotic piggyback.
Okay, great.
All right. Knock, knock, knock. Hello.
Hello.
Hi, Mrs. O'Connor. My name's Latasha. I'm going to be your nurse today, and I'm going to be administering your normal saline and your antibiotic piggyback. And this is my student nurse, Sabrina.
Hi.
She'll be with me today. All right. Let me go ahead and get situated here. Wash my hands. do see you have allergies here, so I'm just gonna verify your allergy bracelet here. And can I have your name and date of birth?
Hannah O'Connor, and 21682.
And you do have the allergy to the trimethoprim sulfasalazole.
Yeah.
Okay. All right. Now I'm going to check that against the mark. I see you do have it here. So what I'm going to do, I am going to go ahead and check your IV for patency. And I'm going to look for any redness or swelling in your arm. It looks pretty good. Does that hurt when I do that?
No.
Okay. And I don't see any redness or swelling here. It looks good. Okay. Okay, so what I'm going to go ahead and do is flush your IV. Minute for 15 seconds. Okay. And the line flushed, clean and clear. Are we having any pain right now?
No.
All right, great. So what I'm going to do first, I need to go ahead and scan. Gonna check the oral.
Check this medication
Or-
once when I take it out.
With normal safety. I'm gonna check the expiration date. And
Right, it's good to
I
go.
want to check for any punctures in the bag, and I want to check the clarity, make sure it's clear. Okay. Now I'm going to go ahead and hang your saline, but I want to spike the bag first. Okay. And I'm going to go ahead and prime the line. And I'm going to go ahead and hang the bag. your name and date of birth, please?
2/16/82, Shanana O'Connor.
Okay. Check it against the mark. Correct.
Leave this for 15 seconds.
Clean it. And I'm gonna verify the rate, which is 30 milliliters per hour. And the volume to be infused, we're gonna put in 950 so the bag doesn't run dry. Okay.
Do not 0.9% chlorinated grape normal saline, potassium chloride.
It's gonna run continuous. So I'm gonna go ahead
And the rate
and
is
start.
125.
Okay. We're gonna go over here and document that we started your saline. Finish documenting here.
Correct. Do it again, Dad. Okay. Alright, I can't do it on camera.
Also, don't bend down to the trash can, because you can contaminate your report if you're near trash.
Okay. Now we're gonna go ahead and register your secondary, which is your antibiotic.
There's just blowing through.
Okay. And I wanna check this medication against the mark. And I wanna verify, because you do have a medication allergy, I wanna verify this medication. It was previously, looked at, there's no contraindications, between your allergy and this antibiotic. Okay. I wanna document the right, what's the right, time.
It's okay, it's all practice.
The right dose and
Tuesday.
the right, amount,
It was just considered
and the right
practice.
medication. Okay? So I'm going to put here, I'm gonna scan your name tag again, and give me your name and date of birth.
Shanana O'Connor, 2/16/82.
Okay. Thank you. Scan completion. Okay. infusion plus statin at 500 milligrams. And I checked my bag for the expiration. There's no puncture wounds. I'm sorry, there's no punctures. Or any leakage. Alright. So, I want to go ahead and spike the medication. I'm gonna prime the line. Okay. Okay, now I want to come over here and I want to lower this back. So make it lower. I need to hang this one higher.
She got some food. There's,
Mm-hmm. Mm.
Do nothing at all.
We're gonna check for the 5 drops.
I think your line might still be closed. Yeah.
It's green though.
You have to.
There it goes.
All right.
Okay. Okay. I'll go ahead and document that I administered the antibiotic.
I'm like, why are people in there?
So how do you feel?
Good.
Good. All right. This is a new antibiotic for you, so I just wanted to give you some things to look for as far as side effects. You want to check for any, rashes. You want to let us know if you're having any nausea or vomiting. If you feel ill, or if you notice any black and tarry stools, you want to let us know immediately. Okay.
Okay.
Okay. All right. Did you have any further questions? for me?
No, I'm good.
No? Okay.
Well, that's the thing is, like, if you and I are,
Alright. Looks like everything looks fine. And I'm going to go ahead and put your call light down here. I'm going to lower your head a little bit.
Okay. I'm comfortable. Yeah.
Okay. Alright. Well, thank you. And just let us know if you need anything, okay?
Okay, I will.
Alright. Alright, did you have any further questions?
Yes. Were there any pertinent pieces of information you reviewed before administering the client's medication?
Yes, you want to always check, patient allergies. You want to make sure, you're checking for the 5 rights of administration, right dose, right time. And if any of this information does not, match up, then you want to withhold the medication until you can verify, that everything is correct.
Okay. And did the information that you had affect your decision to administer the medication?
Like I said, if there are any discrepancies, you want to withhold the medication until the information is verified. And, everything matched for Ms. O'Connor, so we were able to go ahead and administer her medication.
Oh, okay. So it affected how you did it affect how you administered the medication?
Well, yes, with an IV administration, you always want to check that the medication given can be administered by the IV route. And if there was said, like if the order said PO, but I have an IV, I would want to go and, recheck the provider's order to make sure that the patient is supposed to be receiving this medication through her IV.
Mm-hmm. Okay. I think that's all I have for you.
All right, well, it was nice having you with me today, and
All
you
right.
take care.
Thank you so much.
All right, bye-bye.
Bye-bye.